Thank you, WIROC. So the scoliosis is basically not for the occasional spine surgeons. They should ideally be done, who are regular spine surgeons. It's a big topic, and I will try to tell you the things which we are doing to minimize complications and optimize outcome. So you should be able to understand the disease. There are various types of scoliosis. Not every case is similar. You have to plan your management thoroughly. You have to perform your plan accordingly. You have to avoid the complication, and you have to assess the outcomes also. So don't just do it right. And we know we operate because the primary aim remains to halt the progression of the deformity. We want to improve the cardiorespiratory reserve. We want to improve the harmony. So there are various terms: harmony, balance, alignment. Cosmetic correction is again a big concern. It is not just a cosmetic correction. We wish to achieve a harmoniously balanced spine, and it may not be necessarily a straight spine, and if an early onset scoliosis, if they are not treated, they can be fatal also. And there is a small but definite risk of neurological deficit in these population, and they cannot be entirely prevented even with the due precautions. So the bracing, we should not forget, bracing forms an important part of the management of scoliosis. Not every scoliosis is an operative case. Preparing for surgery, you have to prepare them preoperatively with protein supplements, iron supplements, calcium, vitamin D supplements, correct the underweight, even the overweight also, assess their pulmonary function, improve their cardiorespiratory reserve. We use even yoga also. We have a yoga center at AIIMS where we tell them the deep respiratory exercises. You have to do the proper counseling of the patients, explain the risk, explain the surgical goals. So we have this AIIMS checklist now. The checklist, they are becoming very important now. So we have everything like, the pre-operative checklist, the patient before entering the theater, during the theater, after the theater, before discharge. So we have everything as a checklist there. So we are also following the enhanced recovery pathways for these patients. So like, the small things we have published for the lumbar fusions, and now we are going to publish it for the scoliosis also, like giving chewing gums in the post-op period. They enhance the gastric juice secretion and early bowel mobility, giving pre-operative glucose infusions, giving pre-operative gabapentin. So there is a whole, healthcare pathways which we follow. We also do the routine testing. The testing should be complete. Every operative case in our hand undergoes MRI and the NCCT. It depends upon person to person. The MRI is necessary, especially in certain situations in AIS, like left-sided thoracic curves, atypical curves, history of back pain, history of headaches, abnormal neurological examination. Need for surgery depends upon how big is the curve and how big it can get in future. So one has to be also aware of various anesthetic protocols and the challenges while doing the scoliosis surgeries. And I will recommend to read this paper in which we have covered the essential for orthopedic surgeons. When you are doing surgery, you have to consider all these factors. What part of the spine you are going to fuse, what should be your levels, what implants you are going to use, what correction maneuvers you are going to use. These patients, we have seen that they also have some coagulation abnormalities, and there are certain, especially in congenital ones, you have to be very careful about their bleeding profiles as well. You have to use a classification for this thing. We need classifications because you need to assess your outcomes, and these are very helpful. Hello gravity traction, again in very grotesque deformity, especially with cardiopulmonary reserve is low, we use these hello gravity traction in these patients preoperatively. I'm not going to detail of these fusion levels, but you must be careful. We have published this, that there are significant variation in the number of the vertebrae, so you should be careful when you're talking about the AIS, this thing. EOS is a new imaging tool which has come up, and it has changed significantly this thing. We look at each and individual vertebra rotation from this thing, and it changes our management drastically in many of the cases. So just this thing, you go for mostly the posterior approach. We use all pedicle screw construct. We use hooks at the top. We prefer cobalt chromium for AIS. We use uniaxial screws around the apex, polyaxial screws away from the apex. We use the posterior column osteotomies. I don't do VCR or PSOs for AIS. Then I'm skipping the video for the lack of time. Intraoperative neuromonitoring is a must for this thing. We can use the navigated pedicle screw replacement, ultrasonic blade scalpel. Neuromonitoring, we use the multi-model, including the dynamic spinal cord mapping we use. We use the myogenic spinal cord stimulation as well. You have to follow the checklist. In case of any loss, you have to maintain the coordination with your anesthetist, improve BP and all those things. Use freely navigation. If you have navigation, it is coming up a big way, including the robotic assisted pedicle screw placement is coming a big way. 3D printing is again a very useful tool to minimize complication and outcome. We have published this thing regarding the 3D printed jigs. They are also useful. Intraoperative blood loss, tranexamic acid. We are also, the raw time is coming up a big way, and the optimizing the surgical duration is key. In spine surgery, time is blood. You have to devise your innovative surgical techniques for specific purposes, even for the modified, the severe deformities. You should be aware of using all these techniques. Like this is just to show you that the extrapedicular derotation, this is coming up again a big way to selective thoracic fusions. Outcomes you have to assess. We have ASICS app available, in which we give different questionnaires to the patient and we follow them with this thing. Again, you have to keep on assessing. Plastic surgery coordination is also very essential if you are a big scoliosis center. Gait analysis again coming up. Artificial intelligence is coming up a big way. Again, I'm not going to detail. We are working on all these parameters to maximize the outcomes. And recently, we have got the grant for 85 lakh rupees from ICMR, and this project has already started was to to minimize the complication in this thing. So we are using more and more methods, but the important thing is not to forget about the human touch in these patients, which I call true AI, the augmented intelligence. Thank you.